What I'm going to do in the next 20 minutes or half an hour is to talk to you about the work that we are doing in Malaysia with the deaf community. Um, I'm going to talk about healthcare needs in particular. So that's the program that I head. And I will initially talk to you about all the projects we are doing, and I will stress on how patient and public involvement was in this particular project. And I think before I start talking to you all about the projects and the things that we've done, it's important to give you a little bit of an overview about deaf culture to understand the issues deaf people face or how they have been addressed. Then I'll give you some facts about the deaf in Malaysia, healthcare challenges that they face. I will then talk about some of the projects that we do in the program that I had, and I will end by talking to you about sharing with you about the public and patient involvement that was that we did in this particular in the projects that we carried out. Okay, so I think the most important thing for people to understand when you think about deafness or deaf individuals is that they tend to be referred to by two models. The first model, which is often referred to as medical or pathological model, is something that deaf people were referred to many years ago. I believe that the older population of deaf tend to be referred to as people who lack an auditory capability. People tend to focus on what they can't do, that they needed help, and disregarded positive attributes. And this group of people tend to be would be referred to with a smaller d. That is, people who don't always have a strong connection with the deaf community and don't always use sign language. They prefer to communicate with speech. And I would think that this group of people are those who tend to use an auditory help, a cochlear implant, or they tend to be associated more with the speaking people. The second model is called the cultural model of deafness among the deaf culture. Um, and I believe the current generation of deaf people embrace this concept. They embrace deafness as a unique difference, pretty much like a deaf pride, and say that they don't want to focus on the disability aspect, and that sign language is accepted. In fact, they would not like to be referred to as hearing disabled or hearing impaired. They just want to be called a deaf person. And this model tends to be referred to with a capital D. That is the group that shares a cultural identity and a common language, which is sign language. So it's pretty much like coming from an Indian or a Chinese community. So I am an Indian, I am a Chinese. Here they say I am a deaf person and I use sign language to communicate. That's the cultural model of deaf. And many deaf people in the current generation tend to be referred to this. So, some facts about the deaf in Malaysia, there are currently about 50,000 deaf people registered with the statistics department, but we believe there are far more than this. And sign language is culturally and linguistically different in different countries. So in Malaysia, it's called the Malaysian Sign Language, or in Malay, it's BIM. For example, in UK, it's called the BSL, British Sign Language. In America, American Sign Language. Australia, Auslan, Australian Sign Language. The Malaysian Sign Language has its roots from ASL, the American Sign Language, but because it's culturally and linguistically different, you have a lot of different signs which are more related to our culture. And the best way, of course, to communicate with a deaf person is knowing the sign language. Not many people will know sign language, hence you have an interpreter. So the interpreter here is called a JBIM, a sign language interpreter. This is a Malay term. The other fact is for every 800 deaf person, there's only one interpreter in Malaysia, indicating there's a huge lack of interpreters. So what I like to highlight here is that although Malaysia we subscribe to the Disability Act that states that all disabled people have equal rights and access to healthcare like other members of society, the very basic right of provision of an interpreter is not legalized, meaning that when a deaf person needs to see a doctor, there's no interpreter provision. So you can envision that a deaf person faces, I'm just talking about healthcare, but they would have this issue at every sector where they go to. So literally, I'm concentrating on the healthcare challenges, poor literacy. Why? They don't have information available in a language that they understand, which in Malaysia is BIM, Bahasa Isyarat Malaysia. All material is present in English or in Malay, but none in BIM. And their level of understanding in English and Malay is majority of them is not very good. The second is, of course, communication barrier because lack of interpreters. So they tend to communicate with the doctor very often by gestures or writing down notes and giving to the doctor, and the doctor writes it back. They often during healthcare visits, they take their family member or friend, and very, very seldom do they get an interpreter, and that has to be paid by them if they take an interpreter. And doctors or healthcare personnel themselves feel that they're not confident to treat deaf people because of the communication barrier, and this tends to lead to misdiagnosis and medical errors. And obviously, with all these challenges, they tend to have a poorer health outcome. So, with this information, that understanding that the deaf community in Malaysia, and I'm pretty sure that it happens all over the world as well. We carried out a couple of different projects. That's why we started the program called Healthcare Needs of the Deaf, which is our HEARD program. And one of the things that was important for us to do when we started these projects was to reach out to stakeholders who represented or who most of the deaf community belonged to. And so we collaborated with the Malaysian Federation of the Deaf. MyBeam is the Deaf Association and Deaf Studies Association. MyAsli is the Interpreter Association. We also collaborated with our colleagues in Australia, the Ministry of Health, and a couple of different universities. So I'm not going to talk about all the projects that we carried out. So one of the things we realize is that we understand that they need an interpreter when they go for haircare consultation. And then there's a huge lag of interpreters. So having that in mind, we thought that if we could come up with an app where which would help them identify interpreters and book an interpreter, pretty much like an e-hailing service like Uber. So a deaf person basically books an interpreter either in advance or on demand using the app. And they have access to a pool of certified BIM interpreters. From the app, they select who they want to. They go through their profile, they select them, and either decide whether they want to see them in an advance consultation or on demand. And when they go for their consultation, the interpreters are present virtually. So it's pretty much like a video conferencing tool. We've also put in the feature of telemedicine in the app as well to aid telemedicine services for them, which worked out pretty well. We realized that one of the things we realized that much of the sign language in Malaysia, the BIM, not have medical terms. And in doing this app, in coming up with the app, we also developed about almost 300 different medical signs in BIM, as well as medical departments. So meaning that these signs were incorporated into the app for better understanding the deaf community. The other thing that we did, which was a different project, but the output was actually entered into the app was health promotion videos in deaf sign language, Malaysian Sign Language. In order to develop these health promotion videos, we initially carried out focus group interviews, asking them what are their needs, what are the issues, doing a quantitative survey. We developed a couple of videos, which all these appear within the app as well. Okay, so we've done all these projects, and a couple of other things that we realized along the way was that healthcare practitioners didn't really know how to deal with deaf people. So we developed a very short deaf cultural competency course training for healthcare practitioners and medical students. We have since carried out a couple of them. We also got a small grant to develop mental health promotion videos in BIM. We've since developed them, conducted a workshop for the deaf community, and sought some feedback. This is just some of the work that we have done with the deaf community pertaining to healthcare access and healthcare issues. Now, I must share with you some of the facts that we've learned along the way. I'm not saying that we have involved patient and public involvement right from the beginning, but PPI among sign language communities is very minimal. In fact, it was minimal at the stage when we first started. Groups like people from University of Manchester, particularly from Prof. Alice Young's group, they have done a lot of work with the deaf community. We've been learning a lot from them. And one of our experiences when we first started this work in 2016 to 2018, that's where we learned the hard way that a lot of things that we are doing now was because of the wrongdoings or the things that we didn't do in the beginning itself. So what happened was, when we realized that the deaf community in Malaysia were facing huge healthcare access issues, we wanted to actually hear it, do a nationwide survey to find out what are their needs and what they wanted. So we worked with the Malaysian Federation of the Deaf, came up with this fantastic questionnaire, got them to contextualize it, and MFD sent all the questionnaires to all the different associations throughout Malaysia. And when we started getting back the participants started giving back the feedback and answering the questionnaires, we realized something was very wrong. That a whole lot of answers that came back from one particular state or province was everyone answered the same question. So that's when we realized that we were doing it very wrongly. We needed to think about how we did these surveys, and quantitative surveys don't work. Quali focus group interviews are far better with them. Realized a couple of things. So and from then onwards, the way we worked with the deaf community was very different. I'll share some of the things that we did. So it's the important thing we realize is that deaf people need to be involved right from the beginning. Initiation, execution, translation at all phases. So what did we do by embedding in what we did to embed PPI in our work was first to create trust. Okay, I'll talk about each point as we move in a little while. The second thing was to involve them at every stage. The third was to ensure that there's no imbalance of power while we work with them right from the start as well, from conceptualization and even during experiment interviews. Community consultation and collaboration has to be carried out throughout the whole project. How did we create trust? Now, creating trust doesn't mean that we create the trust. It is important to have a person with lived experience involved in the research who's going to be who needs to create the trust with his or her community. In doing so, we actually managed to work with Dr. Anthony, who is the first deaf person in Malaysia with a PhD. So he joined the group, and in fact, a couple of years back, he was made an adjunct lecturer at Monash University. So Anthony is a born deaf person, so he was very crucial in our projects to reach out to the deaf community. We've also got a deaf RA who has vocal capability, Jennifer. She is someone with a cochlear implant, so she can speak to us and also reach out to the community. These two are very important. And I think one of the things that I really would like to do is to get more deaf researchers involved, and to get them, it's very difficult. So we needed to train. I'm getting more deaf students interested in our work, getting them enroll as HDR students and hoping that they get their PhDs. I hope to do that. And we also work with sign language interpreters. We have Ms. Lucy and Ms. Go, who are very involved in our research. So the second thing is involvement. I said it's important to get them involved at every stage, from the stage of research design, when designing the interview questions, contextualizing, assisting us in preparation for the interviews. For example, they advise us on during an interview with a deaf person with an interpreter where we should sit, what kind of screen should we have, how the room should be dimmed, because it's important for them to see our face and expression. And more so, I think this was so important to act as a critical friend and challenge us researchers on the assumptions that we made about them. Initially, it was a bit difficult for them to challenge us, but upon, we continuously encourage them to tell us that what are we doing wrong? Don't be apprehensive about asking us or challenge us when we make such assumptions. Yeah, ensuring there's no balance of power. It is so important because many of them feel intimidated when you have a researcher with a doctorate there. So they tend to hold back. And we took a lot of effort to make sure that there is no imbalance of power throughout your entire process. And yeah, the final thing that we felt was very important is to involve the community that represents the community, the deaf community in this case. Get them involved right from the beginning, getting their feedback at every stage, sharing our results with them. It was so important to do this. So what I'd like to end towards, and I'm going towards the end of my presentation, I would like to share some recommendations if people are working with the deaf community for inclusive PPI. Firstly, to have an understanding of their cultural and linguistic sensitivity, understand and build trust with the community. So all researchers who are involved in the project needs to understand about this group of people. What is their cultural and linguistic understanding? For example, at the beginning, I just showed you all a small thing about deaf culture, but there's far more things about them. And if you're going to work with them, it's important you understand them very well. Second is to remove linguistic barriers. The best way to communicate with them is through sign language. So if you can get all researchers to learn the language, of course, you can't learn the language, but at least show the people show them that you are making efforts to learn the language. Quite often you can't. You have to use an interpreter for more complicated conversations, but that's the best way, direct communication. Yes, importance of a knowledgeable deaf researcher. So at the moment, we only have one, which is Anthony, and I'm really trying. I hope that I can get more young deaf people to enroll for their masters and PhDs. We'd like to have more knowledgeable deaf researchers who can advocate and help their community. Yes, ongoing partnerships with the NGOs, with the organizations that work with the deaf community, not just seek feedback, but build a long-lasting relationship. It's also important to realize that it's important to conduct PPIs in culturally significant places. In our case, we want to do it, or we tend to do it at places where they are comfortable in. So we go to the community and carry out our research or whatever work we want to do with them in these culturally significant places to them. And lastly, one of the things that we realized when we were doing some of the projects was that if it was a project looking at, for example, when we were testing the app out, we managed to get the cancer organization in Malaysia to do a free screening for them. And we imagine the kind of questions they brought to us, which is nothing related to do with the app, but more related, to do with other health concerns that they had, and we have to address this. So we need to understand, give them they have broader health concerns, so we need to address them and make them feel that yes, we are concerned. It's not just the research that we are concerned about. Yes, so these are the few take-home messages that I like to share with you guys, and I'd like to end by sharing with you a quote said by Helen Keller: blindness separates us from things, but deafness separates us from people." With that, I would also like to introduce my team here. So we have people from IT, School of IT, School of Pharmacy, a couple of clinicians, people from IT from Australia. So, and then we have the NGOs from the different organizations and some of crucial people who are involved in the project. And this is Dr. Anthony saying thank you. Thank you guys for hearing me.